to start on time.
Before we start, I just wanted to let everybody know we're going to be recording this for our website, and so it will be available on the website. And if you're a person who would prefer not to have your image recorded for the website, it's very easy to just turn off your camera. If you don't mind, then leave your camera on. And we're also going to stream it to our private closed Facebook group so that people can also get it there.
Well, that's wonderful.
Yep.
Because there's some people who could not make it and asked me if it was going to be recorded. So we're very glad. Well, I'd like to welcome everybody. I'm part of the Faith Community Nursing Program, our Healthy Living Program. We really have to thank Rabbi Spitzer and Edith Kleiman for helping to organize this and at least bring it to my attention to coincide with Hadassah Shabbat, which is this Saturday. But we are delighted to have Dr. Cheryl Spitzer Resnick.
Hold on.
With us. She's a graduate of Harvard Medical School, which is, as we all know, very impressive. And she's been a family practitioner for many years. And she is interested in integrative and natural medicine and is going to talk to us about inflammation, which we have talked a great deal about in our weekly Healthy Living group meetings as we go through articles and discussions. And it seems to be a problem that women, though I'm sure men, are facing. And we are delighted that you were willing to give of your time to share with us this morning. So as Rabbi Spitzer mentioned earlier, if you have questions, just go into the chat group. We will, I don't know how to manage the chat group, by the way. I have to be honest. Karen, can you? I don't know.
I got it.
Rabbi's here. He can do everything.
That's right. Well, like Karen is
Josh is here too in case my connection disappears. And I'm going to mute everybody so that we can hear Dr. Cheryl Spitzer Resnick speak more clearly, but you'll be able to unmute for questions.
Okay. Well, Dr. Spitzer, we will turn the program over.
Oops. My bad.
Okay, can you hear me?
Sorry, I accidentally muted people.
That's okay, no problem. Good morning, everyone. I'm going to talk to you today about how to maximize optimal health and resilience with a secondary concept of normal is not optimal. Western medicine's pretty focused on telling you everything's normal. The bottom of normal is not the same as the top of normal. Physiologic resilience is your body's ability to bend and not break. We're going to get sick. You're going to get something. To repair your body when it gets sick, you have to have metabolic reserve to rebuild tissues that have been destroyed. So the concepts today that I present are actually not commonly discussed in healthcare. So I want to give you a little more background about myself to explain how I came to practice medicine the way I do now, because it's different than your average physician, that's for sure. So I've always loved science, and I did my undergraduate degree at the University of Michigan, and I studied cellular molecular biology, again, back in 1981 to 1985. So from a very early age, I had an understanding of your body on a cellular level, as well as a systems level. Western medicine pretty focused on the systems level, cardiology, neurology, each system. But again, in medical school, we learn deeper biochemistry, but once you get into the practice of medicine, you're not focused on that very much. Anyway, so after Michigan, I went to Harvard Medical School, and then I came to Wisconsin to do my family medicine residency, after which I joined a small family medicine group, and I practiced full spectrum family medicine, doing obstetrics and taking care of 4-generation families for 25 years. And I loved it. I loved my work. I really thought I had found my people. And then my personal health journey interfered. Starting at the age of 30, first I had a miscarriage, then I ended up having 6 surgeries during the decade of my 30s, ending with an early hysterectomy, complete hysterectomy, and a need for hormone replacement. Standard of care at that time, and the only way for a woman to get testosterone if you don't have ovaries, was one synthetic oral hormone called estrotest, which I knew was not an ideal hormone because synthetic oral hormones go through your liver, causing blood clots. And I knew that it would be better to use hormones through your skin, but again, it just wasn't available commercially. But at that point, I played by the rules, and I listened to my doctor, and I was on it for 8 years, sort of knowing that I was going to be on it until I eventually had an abnormal mammogram, because my breasts were going to sense that I was on hormones that cause cells to grow and divide without a turnoff. So that was really my first crisis with the standard of care not being right. And again, I grew up thinking Western medicine was everything. Like if you're like, there wasn't something better. If you're good at math and science, that's what you're supposed to do. And I thought it had all the answers. Anyway, then there was the Women's Health Initiative, which of course was a horrible, horrible study that put back women's health about 10 years. Why? Because they used only 2 oral synthetic hormones that caused blood clots. So the study that was set up to prove that all women should be on hormones really forever because it decreased the risk of dying of a heart attack 50%, like every other study on estrogen showed, instead showed that they got blood clots and heart attacks and strokes earlier. And so instead of actually helping women protect their hearts, because menopausal women start having heart disease the same as men and they die more often, that study made everybody decide they had to take people off of hormones. And we'd put everybody on these bad hormones for 10 years. That was the standard of care. And I would tell people, well, you know, your risk of getting breast cancer is, 1 in 9, but your risk of dying of a heart attack is more like 50%. So you should be on these hormones. Well, then obviously it was clear that that was wrong. And again, most doctors took all their patients off hormones, even if they really needed hormones. So again, I had to be on hormones or I couldn't be talking to you like a smart person. Like no estrogen means I wouldn't find words. And so, so I ended up calling a compounding pharmacy to make me the estrotest that I was on in a cream so that I could be using it through my skin, thereby bypassing my liver. And that's where the blood clots, that's where you induce proteins that make you blood clots. When I felt perfectly fine on that, it helped me make sense of my life journey, that part of what I was supposed to do was help women that wanted to be on hormones or needed to be on hormones to be on the lowest dose in the safest form possible, to be the person they wanted to be. Because when people really change, when anyone who's gone through perimenopause or menopause, they find personality changes as well as body changes. And often those can leave people in a place where they're depressed or anxious or really don't like who they are. And that causes cancer too, So again, it turned out that I became the hormone specialist in Madison, Wisconsin, and I started attending natural hormone conferences, and it was there that I learned about natural progesterone, which at that time was not commercially available and not being used at all. And it turns out that natural progesterone was the natural tamoxifen of your body. It actually decreased not only uterine cancer, but breast cancer. Because of course you wouldn't have a hormone in your body that did something different 12 inches apart in your body, like decrease uterine cancer, but increase breast cancer, which is what the synthetic progestin of the Women's Health Initiative did. So anyway, I came back from that practice and I started prescribing natural progesterone to perimenopausal women, and miracles just started happening in my practice. It was crazy. All the women I had set up to go to see gynecologists to have surgical procedures for their heavy bleeding, the bleeding decreased. The mood problems got better. I had people that had had daily canker sores for 7 years that went away in 2 days when I put them on progesterone. It was truly crazy, and truly just one of the best tools I had ever found in my practice. And yet it wasn't being used by anybody. It wasn't any part of the standard of care. So again, another crisis with why aren't we using this incredible safe tool? It was basically available over the counter in a cream for 25, 30 years. And again, it was what was happening in perimenopause. What happens is your your ovaries make less progesterone. And so then you get higher estrogen, which causes that higher bleeding and higher breast cancer and higher, it causes all the mood swings and all that stuff that happened to people in their 40s. It's all because of this lack of progesterone. And really, I would give people this cream, tell them to put it on in the parking lot when they went and picked it up, and they'd be better by the time they got home. 15, 20 minutes. It was, like I said, crazy. So anyway, other doctors and psychiatrists started sending their patients to me. And again, so I was becoming this more alternative doctor. And to expand my knowledge base, I started going to more integrative medicine conferences and became certified in integrative and holistic medicine, which had just a much larger toolbox to heal people. I can use pharmaceuticals, but I also got an understanding of the importance of certain supplements and stress reduction and exercise and healthy diet, and the importance of your body as an energy system, right? Your body actually is energy, and the energy needs to flow. And when you have, like, for instance, I had 6 surgeries, many of them were in my right lower abdomen. Well, when I was 8, I also had a ruptured appendix in the same place. I now look at those surgeries as I got this big energy problem when I was 8, and I never fixed it until my 40s when I learned about this stuff. Anyway, this is the basis of acupuncture, which has healed people in Eastern medicine for 10,000 years, and other hands-on energy techniques. And it's a profoundly helpful tool to help people heal. So after I would send people to physical therapy and put them on all their medicines for their chronic pain, I now had another tool I could send people for. I even, during that conference, there was an energy person showing us how to help people with headaches. And when I had my hands on a woman's head, 60-year-old Indian woman next to me when I was here, I had this really hard pain, like boom, 3 times, like while my hand was resting on her head. And I just sat there with love, as I was supposed to. And then the conference started again. This was like a little 15-minute breakout session. And the next day, this woman came up to me. She actually pulled over on the side of the road. She was driving out of the hotel area. And she said, I had a headache for 3 days and you took it away. And that was with just putting my hands on her head. It was, again, another one of those kind of goosebump moments that was like, wow, there's more to all of this. So it felt like now I have magic also. I mean, it really felt magical to help with all the other medicine tools. And again, I could send patients for all kinds of different body work that would be useful. And I thought, now I really found my people. This is even cooler than just family medicine. I've got, all these other cool tools. Then in the past 5 to 10 years, my practice is expanded into what's called functional medicine. And functional medicine really looks at a lot of biochemistry. We do a lot of lab testing, and you look for the root cause of disease. And while at each step of my career, I thought I found my people, these are really my people, because we use science, and medicine does not always use science anymore. There's just protocols that are set up. You have depression, you get referred to therapy, you get put on Prozac or a medicine like that. Now, if I treat somebody with depression, I'm also going to make sure they're not vitamin D deficient. I'm going to make sure their thyroid's okay. I'm going to make sure their hormones are balanced. And I can give them Prozac if they need it. But if I fix the problems at the base, then they don't need the pharmaceutical tools as much. And they can get off them eventually. And if you're not aware, I would tell you that about half of America at least is on antidepressants. And it didn't used to be that way. What is wrong with our society that is the case? Anyway. So I really do think functional medicine is where you get the smartest people that really want to look at science to help people that have the hardest problems to fix. Irritable bowel. Basically, tons of people have a diagnosis of irritable bowel with diarrhea or constipation. What does that mean? It means you have a stomach ache we haven't figured out yet, right? In functional medicine, we fix it all the time. You do a microbiome test and you can see that people have abnormal bacterial balances or something that's a pathogen and fix it. Or maybe you see eosinophilic protein X, which tells you they actually have food allergies. And again, you can fix autoimmune disease by doing, elimination of certain foods and fixing people's gut. So, and we pay attention now there's genomics, right? So, you can get 23andMe and see your genes. Well, if you actually pay attention to that, there are genes called methylation genes. And so B vitamins are important for everything that happens in your body. And in the past, if I did a B12 level on somebody and it was high, I would say, maybe you should cut down your, you don't need to take so much, you can cut it down. Now I know that a lot of people who are high, actually, they're high because the B12 can't get inside their cell where it works. So they can have a high bloodstream level, but it's not working, because what works is what gets inside your cell. So I do another test called a homocysteine, which is sort of a screen for this methylation problem. So if you have a high B12 and folate and you have a high homocysteine, you've got this problem. And in fact, I even had an 80-year-old who came to see me who had neuropathy in her hands and feet for 40 years, and everyone in her family got it. And I was like, that sounds like a methylation problem. She had this really high homocysteine. I actually put her on methylated B vitamins, and she got better after 40 years. I didn't actually really expect her really to totally get better, but she did. And again, it's that her body, and if you have 2 genes of this problem, you can't use regular B vitamins. So you can eat all the kale you want, you can eat all the greens you want, but you won't be able to absorb that B12 into your cells where it works. So you have to find what's called an activated or methylated B vitamin that gets inside your cells. And then it's dramatic. Fixes people's memory problems, fixes energy. It's just crazy. So your gut is actually where the outside world, pathogens or food, meets your immune system. And so it's why food is so important to you. Anyway, so I talked about the depression today. So anyway, so the Institute of Functional Medicine is where you find providers that look deeper at this at these kind of problems. And again, if you go to either the Integrative Medicine website or the Functional Medicine website, you'll find providers in your area that do this kind of work. Some of them are in the system, many of them are not in the system. You'll see. And again, do you need them if you're feeling healthy? Probably not. But some people actually just come just to make sure things are in order. Anyway, the information that I'm going to share with you today mostly comes from the functional medicine training. But of course, I know everything from most of my life. So the first major concept, and again, what the title of the conference was, is that chronic inflammation is the root cause of all chronic degenerative diseases. And that means diabetes, hypertension, arthritis, Parkinson's disease, dementia, autoimmune disease, cancer. They're all related to chronic inflammation. So in my practice, I measure an inflammation test on everybody. And I do it when they're well. Because if you're sick, your inflammation marker, it's called a high sensitive CRP, it's going to be high. But if you're well, it should be normal. And if it's high, it means you have chronic inflammation from something, and we need to find it, because if not, it's going to cause problems for you. So how do we reduce inflammation? The first concept is that food is medicine. You are what you eat, and you are what you don't eliminate. You'd be surprised at how many people told me that they go to the bathroom once a week. Oh my God. That lets all kinds of toxins recirculate and make you sick. It makes your hormones recirculate and give you cancers. You have to be figuring out how to get a bowel movement every day, maybe a couple of them. Good diet and digestion is critical so that you can absorb nutrients. The only diet that's been shown actually to decrease your risk of dying is the Mediterranean diet. They're the people that live the longest in the world. What do? They eat everything, but they eat whole foods. They only look like foods. They eat lots of vegetables and fruits with lean meats and proteins and fish and whole grains. So really you need to avoid processed foods. You want to look at your labels of the food you buy and not buy things that have 10 different letters and ingredients on there that you don't even know what they are. You don't really want to eat those things if you can avoid it. So you want to buy organic when you can. And you might want to use a veggie wash to wash off residues of the pesticides and other things that come on our food if you're not getting organic. The Environmental Working Group, this is a good thing for you to look up, ewg.org. They put out every single year a list of what they call the Dirty Dozen and the Clean 15. And they basically test tons of fruits and vegetables and figure out which are the worst ones that you should focus your money on if you're going to buy organic. Because these ones have the most pesticides and toxins. And then the Clean 15, again, if you can get organic, great, but it's less important. Similarly, if you eat meat, being vegan is great, but if you do eat meat, getting grass-fed meat or organic meats are going to be less inflammatory because they have more better omega-3, omega-6 balance. When you buy traditional meats that have been finished off with corn, which makes them whatever, softer or better or something, but they finish them off with grain and corn, they get more omega-6s, and that's what's inflammatory. So the more you eat that, the more you need to balance it with omega-3 supplements like fish oil. Or again, change your diet. But you also want to eat the colors of the rainbow. You should focus on eating like at least 10 servings a day of fruits and vegetables. And again, the brighter the color, the better. They have more antioxidants, bioflavonoids, all the things that help your body in the anti-aging process. You need your gut to be healthy, which means you need healthy bacteria there. So eating fermented vegetables like kimchi or sauerkraut, or eating yogurt, kombucha, those things also help your gut and your health. Good thing to be working into your diet. Drinking 8 to 10 glasses of water every day, filtered, is better, because chlorine is not really good for you. And there's a lot of other bad chemicals in our water they don't tell you about, nor do they test for. If you're overweight, consider trying to lose some. Many people are doing intermittent fasting now. It can be done in one of two main ways. One is that you try to get your eating time down to 8 hours during the day. You don't go straight to that. It's a very hard thing to do, but you might start trying to decrease the hours that you eat by an hour at a time. And if you really get to 8 hours a day, it really helps your insulin level drop very low, and people lose a lot of weight. And again, high sugar is inflammatory, so bad for you. Some people do intermittent fasting by eating 500 calories on 2 days of the week and eating normally the other 5 days. That also seems to work. Again, as I said, sugar is very inflammatory. You want to try and limit it, right? We have more problems in society now than they did in the old days, because we have like nicer pastries and bakeries and all that stuff, but it's not good for us. So again, to figure out what I'm a foodie. I like good food. I don't like not eat all those things, but I try to balance it with other good stuff. Now, dark chocolate is good for you. It's got antioxidants, bioflavonoids. We encourage people to get good dark chocolate and have it, because it can fill your sweet craving without even eating a lot of it. And again, the darker the chocolate, the better it is for you. The other thing is green tea. Every day I make green tea in the morning, then I refill it again. Then I try and put another tea bag in the afternoon to drink more. And that's because 4 cups of green tea daily is already shown to decrease inflammation. It even decreases a process in COVID-19 replication. It decreases cancer. Drink green tea. It's easy. You can put any flavor in it you want. It doesn't matter. It doesn't have to be straight. It can be peppermint. It can be anything. You won't even notice the green tea. And it can be decaf if you need to be off of caffeine. Okay, number 2, sleep. Sleep is critically important. It's when your body heals itself. You really need 6 to 8 hours minimum. You need to be in a dark room. You want to turn off blue lights. You want to try to get off the screens a half an hour before you go to bed. If you're still having a problem with falling asleep or staying asleep, you might try melatonin. Melatonin is a natural hormone that decreases as we age. It's quite safe. And again, in doses of 5 to 20 milligrams, it's anti-inflammatory and anti-cancer. It helps your immune system. So why not? 3 milligrams worked for me, but I have a history of cancer, so now I take 12. And again, I think it's just more protection. And I do sleep well. And when I started it, I actually started dreaming. And I would say most of my life, I didn't feel like I dreamt. Number 3, exercise. By exercise, I mean moderate exercise, not running triathlons or marathons. Those actually cause your body to get inflamed because they're actually a little too much for your body. But moderate exercise, whether it's walking or a mixture of aerobic and weight training, it can actually help you make more white cells that fight infection and make more antibodies that fight infection, as well as it lowers your stress hormones and helps your sleep. With your exercise, you want to do you also want to do flexibility and balance work, because people don't break their bones because they have osteoporosis. They break their bones because they fall. So if your balance is better, you're going to be safer. So again, you really kind of want to focus on all of it. And things like, and again, Eastern medicine's known this for years. Most of their qigong, yoga, all those things that come from the Eastern cultures, they all not only work on your body to relax, They help your nervous system relax. And again, they help you get better health and balance. Number 5, have an attitude of gratitude. Try to focus on what you can be grateful for. We all know that there can be a cup that's half filled with water, and some people are going to see it half full, and some are going to see it half empty. So you try to be one of those half full people. Laugh where you can. These things make you more emotionally resilient, and the more emotionally resilient you are, the less your emotions are going to adversely affect your body. I relate a lot of my chronic health problems to stress. I just couldn't manage. Even while I loved my work, it was so busy, I never felt like I had enough time to take care of myself. So again, finding that time is important. Connecting to your friends and family is important. It's so interesting that here in this time where we're all physically, socially isolated, we now have Zoom, right? And I'm talking to you from Madison, Wisconsin, and my family, which has been spread across the country for years, we now have a family call, a Zoom call every week. And you don't show up every week, but it's there and we can connect. And that's incredible. And that's a function of this pandemic, making people figure out another way to communicate. So again, many of my friends, and again, it's probably partly because we're in the 60-year-old range and we don't mind hibernating a little bit or being in our place a little bit. So it's worse for 25-year-olds, but many of my friends feel sheepish to admit that there have been benefits to them by this pandemic and being able to slow down and be in their space a little more. So number 6 is, again, where functional medicine becomes so important. It's addressing nutritional deficiencies. Nutritional deficiencies make you more susceptible to illness, and they also make you not recover. And they make you have, if you get severe inflammation and you just don't have the nutrients to heal your body, it's going to go into overdrive. That's that cytokine storm that kills people or that causes long COVID. They get chronic inflammation. Again, Western medicine, I know he's talking about what you do to help those people, but it's an inflammatory process, and we have tools that decrease inflammation. You might think that you eat healthfully, but the soil's been depleted of many minerals for many years. It's been very clear. You can't get magnesium from your food anymore. You have to supplement it. Almost everybody is low. In addition, many medications that you're on cause nutritional deficiencies, and doctors don't always tell you that. People are good about telling people when they're on steroids that they need to take vitamin D and calcium, but even wearing sunscreen to prevent skin cancer makes you not absorb vitamin D from the sun. Proton pump inhibitors. A lot of people are on Prilosec, omeprazole, Prevacid, things to turn off your stomach acid to prevent indigestion. Well, guess what? If you totally turn off your stomach acid, you don't have stomach acid to kill bacteria that come into your system. It's your first line of defense. It also, without stomach acid, you don't digest protein, nor do you absorb your B12, your vitamin C, your calcium, or your iron, or your zinc as well. So if you're on one of those medicines, it'd be lovely to get off it, but many of us aren't able to get off of it. And so what you need to do is take digestive enzymes that have a little bit of acid in it to help you digest your food better so that you can actually absorb nutrients. And again, you might need to supplement some of those nutrients. If you take a cholesterol medicine, any of the statins, atorvastatin, Crestor, any of them, they all lower your CoQ10 level, which is called ubiquinone. So ubiquinone is part of the cell energy metabolism of every cell of your body. Every cell has millions of mitochondria, and they run your body. They run all your energy. It turns out they even turn on and off genes. So if your mitochondria aren't working well, then you get cancer. It can turn on a gene that gives you cancer or makes you sick. Or and again, there are side effects of those medicines that can be like muscle weakness and even liver problems. A lot of it's related to the lack of CoQ10. So I never gave people a prescription for it and didn't say the other bad thing I'm doing is that you need to go buy CoQ10. And actually, I say CoQ10 because it's usually written that way and people have heard of it. But really, that's actually the oxidized form. And in general, we want to antioxidize our body. Oxidation is like when an apple turns brown. It's like it's rusting. Well, that's what your body's doing if you don't have enough antioxidants. So, anyway, it's actually ubiquinol is the active form, and it's more potent than CoQ10. So it's actually the ideal form you want to get. And 100 milligrams of ubiquinol is like 300 milligrams of CoQ10. But again, anything's better than nothing. And it really does help people cell energy, and it helps their mitochondria be healthy, which is going to help keep your DNA healthy, which is going to help keep you from getting dementia too. Right? Statins have already been shown, particularly in women, to actually increase our risk of diabetes. Why is it? It's because it makes our cells not work as well. If they don't have energy, they can't work, and they do everything for you. Metformin, tons of people are on metformin for their glucose intolerance or type 2 diabetes or polycystic ovary disease for women who are younger, and it totally lowers your B12 levels. So if you're on it, you have to take more B12. A lot of the blood pressure medicines lower your zinc levels. And again, zinc is critical for your immune system. So you need to have good nutrient levels to prevent disease and to rebuild and repair cell tissues after an illness. And again, in Western medicine right now, doctors are discouraged from doing vitamin D levels and nutrient levels on people because it costs money. And unfortunately, the insurance system really is running doctors' lives at this point. The difference between medicine when I started in 1988 and now is like night and day. You spend a lot of time having to argue with insurance companies about what tests you do, and it's not the doctors leading the show anymore. And so sometimes you just can't get what you need in the system. For instance, thyroid patients. Everyone is screened with a TSH test. And there's a big range of normal of that TSH test, 0.5 to 5. And anything in that range is normal, right? But if you're 0.48, you are really just a smidgen from defined low thyroid, right? And you'll have all the low thyroid symptoms. You might be half bald. You might, have been tired for years and gained 40 pounds. And they'll still say, oh, you're normal, right? So, but you're not optimal. Really you want to be in the 1 to 2.5 range where it's optimal. In addition, it's not even TSH that works for you. That's actually your pituitary hormone. The hormone that works for you is free T3, and they hardly ever check it. So again, I have a huge thyroid patient practice because people read low thyroid symptoms and they're like, I have them all, but my doctor keeps telling me it's not my thyroid because I'm normal. And I do a free T3 level and they might not have any. Even people that are on, I had one patient who was on 200 micrograms of Synthroid, which is the synthetic T4, which is the standard of care. Everybody with thyroid problems is supposed to get that hormone. And again, she had just had her thyroid removed. She's seeing the endocrinologist at the UW hospital, and her TSH was perfect at 1.4 and her free T4 was a little high. It was normal at 1.4, but higher than I like to see it, because I know if it's that high, they're not turning it into T3. They told her to come back to see me so I could increase her Prozac for her depression because she was tired and depressed. And instead I did a T3 level and she had none. Her level was 2 and normal was 2.5 to 4.5. So I put her on a natural thyroid supplement. You could also use synthetic T3 with your synthetic T4, but I fixed her T3 level, and in 2 weeks she was better and she was normal. She really didn't need more Prozac for depression. She needed her thyroid to work. Okay. It again controls everything in your body. So in integrative and functional medicine, there's a concept that basically everybody should be on 5 main supplements. A good multivitamin with high levels of B vitamins, because B vitamins are part of everything that happens in your body. And again, I've already told you how we lose many of them from so many things. Again, I use a multivitamin that not only has a lot of B vitamins, it has these already methylated activated ones. So it sort of bypasses that genetic issue that 10% of people have. And I happen to have one gene of it, which means I could use regular vitamins, but I need 40% more than the average person. And so I take like 3 sources of B12, but if I don't, I'll start waking up twice at night. And if I take them all, I sleep all the way through the night and my energy's good and my brain is still growing and being smarter in my 60s. I like that. Vitamin D, number 2. If you're in a northern latitude, which you guys are, almost everybody's vitamin D deficient unless they're supplementing. And 1 to 2,000 units is not enough for almost anybody, unless you have calcium kidney stones. And then I never have people go above 2,000 because they'll absorb more calcium and have a problem. But most other people are going to need 5 to 10,000 units to get to an optimal place. And again, here's where normal's not optimal. The range of normal is 30 to 80 or 100, depending on which lab you use. And I see people all the time whose doctors told them they were normal. They might have even been deficient, got treated, then they're 32 and they say, okay, great, you're normal, take 1,000 units a day. And they're going to be right back at low again, in no time. And I see them and yep, sure enough, their vitamin D is 23. When you get your vitamin D level to the mid 50s to 60s, it totally helps your immune system. It decreases your risk of getting multiple sclerosis. It decreases your risk of breast cancer recurrence. It helps your immune system fight infections. When I started putting people on vitamin D, every single person came in the next year and they go, I didn't even get a cold last year. It was dramatically noticeable within the first year of treating people. I'm just telling you, that kind of gives me my weird goosebump sign that I get when I'm saying something that's really right that you need to listen to. Third thing is fish oil. Fish oil is a great source of omega-3s. Again, if you're vegan, you can get algae oil. There's flax and chia seeds and things like that that are omega-3s. It's great, eat more of them, but you got it. You have to eat just tons of them to equal what you can get in a concentrated, high quality fish oil. When you get fish oil, you really want to look at the back of the bottle and see how many omega-3s you're getting, because that's why you're taking it. You're taking it to balance the omega-6s in your body that are inflammatory. The worse you eat, the more you need. If your cholesterol's high, this is incredible. It's also incredible for your joints and your brain and everything. And it's part of treating depression from a integrative method is to give people high dose omega-3s. So again, some good fish oil source. And again, I take one that in one capsule gives you 1,000 omega-3s. Many of them have 300 omega-3s. So while I take 4 of mine a day, you would have to take 12 of those other ones, which you're not going to do. Plus you're going to get a whole lot of oil. And who wants to get fat on fish oil, right? You want to eat your calories in places you like it, So again, get a concentrated one so that you don't have to take a lot of it and you still get that anti-inflammatory bang for your buck. The fourth supplement is turmeric. Again, eat curries. You can eat lots of turmeric. It's great for you, but sort of like probiotics, which is going to be number 5, to get turmeric's hard to absorb, and to get a really good therapeutic level of it, you're probably going to need a pharmaceutically, optimized form of curcumin that has a pepper mix in it that makes it more absorbable. Again, when I take turmeric, I don't feel the arthritis in my hands. When I missed it for a day because I had run out, I had to take ibuprofen, and I almost never take ibuprofen as long as I take my fish oil and my turmeric. So again, great for pain. And again, pain's just a physical symptom I'm aware of. It also will lower your CRP level. It will decrease inflammation. So again, when I see people that have a high inflammation test, I'm going to put them on fish oil and turmeric to lower it. But I'm also saying, well, why are you inflamed? Do you see the dentist? Do you get dental work? Because dental disease is a huge cause of inflammation, and people with gingivitis get heart attacks more. So you got to have good dental health. It's a place where bacteria cause inflammation in your body. Again, I talked about healthy bacteria, probiotics, again, eating organic yogurt, drinking kombucha, eating your fermented veggies, kimchi, sauerkraut, doesn't matter if it's on a Reuben, those things help feed your gut healthy bacteria. And it turns out that the bacteria in your gut actually make your neurotransmitters, right? So those people who don't go to the bathroom, they're all anxious, probably depressed too, but they don't make the right neurotransmitters. So again, what you eat makes a difference to how you feel. And like with the turmeric, a good probiotic might be like eating 15 or 20 cups of yogurt in one capsule. So you really can get, greater therapeutic effectiveness if you take a good supplement. And just to mention good supplements versus not as good supplements, if you can get supplements that say they're pharmaceutical grade, which means they're tested by a lab that isn't in there, that doesn't sell it or make it, so you're getting objective data, then you actually get what they say is in the vitamin. If you buy vitamins at CVS or Walgreens or any of the big box stores, most of those are not tested. They don't have to be tested. That's why a lot of studies say, supplements don't work. Centrum is a terrible multivitamin. It has hardly anything. We can take x-rays of people that have taken it and see it whole in their intestines, not dissolved. So again, it matters what quality you get. You get what you pay for, and you don't always have to get the top, but you really want to get something that's better. If there's a health food store or natural farm, natural store near you, they're more likely to have better supplements because they care. So in this time of COVID, all those things are critical. And then there's other supplements that can help you also, and particularly with viral infections. Again, I put vitamin D right up there at the top. It's shown to decrease the susceptibility and the severity of infections, helps your immune system, decreases viral growth. Again, get a level, try to be in the 50s. Vitamin C, 1 to 3 grams daily, helps prevent and shorten the duration of viral illnesses. It's anti-inflammatory. They're using it intravenously in hospitals to treat COVID patients. Why wouldn't you have vitamin C in your house? If you don't take it regularly, like I eat a lot of citrus, so I don't take my vitamin C 1 gram every day. But if I got exposed to somebody who was sick, or I started getting sniffly or sick, I sure would go on my 1 to 3 grams of it every day. And it's shown to get you well faster. Same thing with zinc. If you use zinc lozenges when you start with an upper respiratory infection, it really helps your mucosal immunity and shortens the duration of the illness. So again, if I were to put the 3 top vitamins that you take to prevent COVID, it's D, C, and zinc. And Dr. Fauci takes all 3 of them. There's other ones that are good for you. Selenium is great for you. You can get that, again, if you're taking a good multivitamin, it's going to have selenium in it. But actually eating 2 Brazil nuts every day gives you the amount of selenium you need. It doesn't matter if they have chocolate on them, it doesn't really matter. It's still going to give you your selenium. A few more that, again, I want to focus that those are the top 3 because I don't want to overwhelm you with too many things, but just to mention, once again, the other things that are actually on a chart that the Institute of Functional Medicine put out of supplements that actually have evidence behind them to help your immune system. Some of the other ones that are listed are, again, melatonin, which I talked about before, decreasing inflammation. That's part of why they think we lose our melatonin with age. And it's part of why they think that young people do better with COVID than older folks is that melatonin thing. So if you're not sleeping, a little melatonin might be good for you. Vitamin A is important for your mucosal immunity. They actually have a high dose recommendation on the list. I think it's fine for, particularly if I get sick, but most multivitamins will have a good amount of it in it. I checked a level on myself and just taking my multivitamin, my level was right middle of the range, above the middle of the range. And so most people don't have to do high dose vitamin A supplementation. And again, because it's fat soluble, there are some people that could get liver toxicity. So I don't push that high, but if you're not taking any, again, get it in a multi. Elderberry is a natural flower, basically, that has tons of vitamin C, fiber, and antioxidants, and it's been shown to decrease the risk of influenza and prevent influenza and treat influenza, like as well as Tamiflu. So it's a great supplement. You can get a form that's very concentrated in this actually quite good tasting grape liquid, and I generally hate anything that has a taste that isn't real food, but this elderberry liquid is actually quite good. And then they also put elderberry in a lot of combination antiviral supplements, again, because it's antiviral. Again, don't forget green tea. You can take green tea supplements, but again, it's easy to drink. So why not just drink it? I already take 1,000,000 pills and I tell people to take 1,000,000 supplements because sometimes you need them. But again, green tea has been shown to target one process in the COVID-19 replication. So again, it's an easy thing to help prevent disease. Besides washing your hands and social distancing and wearing masks, there are things you can do that make your body stronger. The last one I'm going to mention is called NAC, capital NAC, and NAC turns into glutathione, which is the master antioxidant of your body. So it supports your immune system. It decreases the severity of your symptoms, and it actually helps prevent pulmonary fibrosis. So again, many people that die from COVID, it's because their lungs become stiff and can't be expanded even on a ventilator. NAC helps prevent that. NAC's being used at University of Wisconsin Hospital for their pulmonary fibrosis patients now because it's great. But honestly, it's the best antioxidant to your body, so it works for inflammation, for everything. So any chronic pain syndrome, any inflammatory syndrome, autoimmune disease, NAC or glutathione, you can also just get glutathione, it's just more expensive. And again, the sicker you are, the faster it gets used up in your body, so the more you need. So I might take a glutathione at one point in the day, and I take NAC at another point in the day to help replenish it. But again, these are tools you can use that can really help the quality of your life and the strength of your body to resist the outside world. So that's what I prepared. And I probably said a lot of things for you. So I'm open to taking any questions and any thoughts? Can't hear you. Yeah. There we go. I'll drink my green tea over there.
I think I missed one of your 5.
5 main things.
Yeah,
So we got
I have-
the multivitamin with high Bs, vitamin D, fish oil, turmeric, which is
no,
called.
I'm back further in your,
Okay.
where you did food is medicine is your number 1.
Uh-huh.
Sleep is number 2.
Yep.
3 is exercise. 4, I'm missing.
Well, you know what?
Okay.
I think I might have forgotten to say it. Maybe I think I forgot to say it. So thank you. So 4
You're
was stress
welcome.
reduction. 4 was stress reduction. I missed it in my like scratched up notes here. So most of us work too much in America and we're running stress. And when you're stressed, your adrenal glands are dumping out hormones that eventually get used up. So limiting stress. So when you're stressed, your body gets into what's called the sympathetic tone, the fight or flight system gets up and it raises your blood pressure and increases your pulse. And of course, makes you feel bad. Just taking 3 deep breaths in through your nose and out through your mouth can really just down-regulate that whole sympathetic system and help your parasympathetic system, which helps your body rest and digest your food, be more prominent. So again, things like meditation, yoga, qigong, tai chi, all those things actually really help down-regulate your stress system, and that helps your immune system. Be strong. I definitely relate a lot of my chronic problems to the fact that I lived stress just by being on call for 30 years and being up, half the night for so many years. It didn't stress my emotional brain till I was in my 40s, but it was stressing my body out for 25 years. And it wasn't until my body was really about to break and screamed at me that I actually went, oh, stress is a problem. I have to figure out how to sleep through the night, And again, that was just part of the evolution of my career. Thank you for bringing that up. I really did mean to say that. So
What enzymes would one take if they need to be on omeprazole?
So you want to be on one that has a little bit of betaine, which is hydrochloric acid, so that you're giving your body back a little bit of acid. It's one of these weird paradoxes where, again, most people are taking it because they have indigestion and reflux. But if you don't have any stomach acid, the sphincter that actually keeps acid from refluxing won't work. So you need some acid in your stomach to prevent the reflux. But again, people feel better if you just turn off all of it. Sorry, lost what I was going to say. So something that has some acid in it and then that has digestive enzymes like proteases. So I take one called orthodigestizyme, and it actually has ox bile in it. So it helps you break up fats and digest your fats better. And again, if you don't want something with ox bile, you can get vegetarian ones that have, again, lipases, proteases, things that help you digest your protein, your fats, your carbohydrates, like lactase. A lot of people have lactase deficiency. My enzyme that I take every day has lactase in it also to help digest that. But again, the main things are that you need a little stomach acid. And again, the things with ox bile, if you're willing to take ox bile, is really useful. And people that don't have a gallbladder also really want to use something with, the reason they get such bad fatty food intolerance is because the way your body works is if you eat some fat, your gallbladder squeezes out bile to help emulsify it so you can then absorb it. Well, if you don't have that, then all that fat's going to go downstream. Your bacteria are going to metabolize it, and you're going to have a lot of gas and bloating and also not be able to absorb things.
Dr. Resnick, you mentioned turmeric. Now, turmeric has also been shown to cause some cerebral bleeding and other bleeding. How do you moderate the dosages?
If somebody really is, I'll tell you that fish oil also can make people bruise and bleed more. And so in general, for many of us, we're more likely to make clots than bleeding. That being said, there's some people that if you're on blood thinners, you're going to be a little more careful. Like for me, I take 500 milligrams of turmeric twice a day, and it's awesome for me. And I don't bruise, so I think I'm fine with it, as well as my high dose fish oil. But I tell people if you're bruising or you're having a bleeding issue, then you have to cut back. I don't really check a level of it. I don't really check a level of curcumin. But I check that CRP test, and again, taking turmeric's not the only way to lower your CRP. Changing your diet and lifestyle can also change it. But some people aren't going to take those things. Some people, again, that's a general recommendation, but obviously the benefit of personalized medicine is you have to adapt it for you. So if you're somebody that has a bleeding disorder, you're going to be a little more careful with turmeric, but you still might take some. I don't think that I've actually never had anybody have bleeding or bruising from turmeric. I've had an occasional person tell me they think it might cause some indigestion in them. I always take mine after breakfast and after dinner. I've never noticed a problem. But again, you always have to pay attention to yourself. Your body's the most important thing, and not everything's going to be good for everybody. But in general, most people are deficient in those things. And so and most people have inflammation they're not treating. And things like dementia, right? Western medicine's treatment of dementia is terrible. Aricept barely does anything. It's like shortens duration. It shortens the time to admission to a nursing home by days. It really is minimal. So really the key to dementia, if you're at risk for dementia, is preventing inflammation when you're younger, is to try to get on these things and check your CRP and make sure your inflammation's in control and feed your mitochondria, whether it's CoQ10 or other things that help your mitochondria work. And those make your brain healthier. David Perlmutter is one of the big integrative neurologists. And again, there's various supplements that actually help oxygen to your brain. So there's all kinds of natural supplements that you can use in for various diseases that make a big difference. And again, bleeding problems, you just have to customize things for individuals.
Okay. Any other questions? Anything in the chat room?
There's nothing in the chat, but if anybody else wants to ask a question, you can unmute and ask.
I do have another question for Dr. Resnick.
Uh-huh.
The label on a lot of melatonin bottles say people should not use if they have high blood pressure.
Why?
I haven't found anything that says why, so I am asking you that question.
Yeah.
Because it's there, and this is on some of the good vitamins too. I was reading them in the store, and they said something about you should check with it can
Check
be
with your physician if it's okay. I'm gonna
Yeah.
go look at my bottle. I don't think I've ever read that on it, but I'm not always the best at reading my bottles. But I don't have any sense that that's an issue, honestly. And I just don't think that's the case.
Yeah, I couldn't see a connection since it relaxes you and helps you sleep,
Right.
but I'm asking you the question.
Right. There's and again, there's a lot of, on a lot of medicines, they're going to write things like that because it just protects them, like let's say you're taking melatonin and then you have a problem. Maybe you're going to try and sue that company and say it was part of the problem. So they're just going to say, don't take it. Right. In the same way that they tell you your medicines expire in a year. There's no study that shows that medicines expire in a year. In fact, there's studies that show that they're 100% effective usually for 3 years, except for nitroglycerin, which does degenerate much faster. But they're going to say it expires in a year because if they don't, then they have to test it and prove to you that it's 100% effective after a year. And it's better for them if you just throw it out and buy new stuff. So the system's a little bit mixed. It's not really all going for you, right? There's big companies trying to make money and insurance companies trying to make money. And so you have to be your own advocate. You have to look harder and, find somebody, if you really think that if somebody's telling you, oh, it's just your age or it's whatever, and you just don't really think that, then just look harder.
There is a question
Eleanor.
in the chat. There's a question in the chat that says, are there any special bacteria in the probiotics to look for?
So actually, really good question. The probiotic field is just going nuts right now and expanding. And the fact is, the more we learn, the more they get that there are certain bacterial strains that are better for weight loss and certain bacterial strains that help moods better. And I would say that the main thing for people to know is that there's a thing called Saccharomyces Boulardii, which is actually a healthy yeast. And it's the only thing that prevents what's called C. difficile colitis when you take antibiotics. So, right, a lot of times people can get a terrible diarrhea syndrome after antibiotics that's caused by this pathogen called C. difficile. If you're taking an antibiotic, get a probiotic that has Saccharomyces Boulardii, and it will actually prevent it. I took high dose antibiotics for a long time for a chronic mycoplasma skin infection, and I never had a problem from it because on the other part of the day when I took my antibiotic, I took 2 of these, what's called orthobiotic, that had 20 billion mixed bacteria and 3 billion of the Saccharomyces Boulardii. And again, I took a lot of antibiotics for a long time and never had a major gut problem. And so it really does help. There's a lot of them that are available. Again, you want to get something that has billions more than millions. I mean, really, when I do a microbiome test and then I have to fix somebody's gut, I'm usually ending up starting them off on 225 billion bacteria, which is really high dose because that part will actually help your immune system. And then I kind of taper them down. You know, I do that for a week or two and then kind of taper them down to 100 billion and then 20 or 40 or 50. And the other thing that's really important that you can get with your probiotics now is prebiotics. So prebiotics are the food that your probiotics need to set up shop in your intestines, right? So currently, like I have a new one in my practice called Synbiotic that actually has the prebiotic with the probiotic. And again, it's like 50 billion of probiotic, but I had like 4 people tell me that within a week of starting that particular probiotic, and they had already been on the other one, that stomach aches they'd had for months got better. Because again, it gave them the right fiber to help the bacteria stay.
Can you hear me?
Yes.
Okay. I'm a person who was on 40 milligrams of Nexium, and it was not easy to take it. And I negotiated with my gastroenterologist. I eventually switched to Zantac, and I cut it down to 20. And now I'm considering cutting the 20s in half and seeing what minimal dosage twice a day gets me through without the reflux, the symptom of acid coming back up. And I'm finding that I do better with 2 times a day, smaller amounts. So I'm cutting the pills. And he said that's fine to, you know, see what I can manage with at minimally.
Right.
Isn't Zantac the one they took off the shelf?
Yeah.
You're on famotidine. Aren't you on famotidine?
Many of us were. I used Zantac for years, and now I put everybody on famotidine, which is Pepcid, because the Zantac
Right.
toxicity.
It's
But what you're doing is perfect, because it's very hard to get off those medicines, especially the ones that totally turn off your stomach acid. It's like they're actually like addictive, because again, you go off them, you get worse. So they make you have to stay on them. So really the only way to get off them is to taper them down slowly, like you're doing, and doing it, you know, doing half twice a day probably helps that. And again, feeding your gut with healthy bacteria will help your gut heal. There's other supplements like zinc carnosine or aloe vera. There's other things that can help cool down your gut and help you in that process. But you're doing exactly the right thing. And you know, again, it's just one of those evils of our society. They fix your symptoms so they feel great, but then they cause all these other problems downstream. And so it's great if you can get off them. And if not, you want to be on the lowest dose that you need. I think David Perlmutter is in Albany. Somebody else wrote that there. I think he is from Albany, but he has a lot of books out, and again, an integrative approach to preventing dementia.
Question. What if dementia has been diagnosed?
So it can get worse and it can be stable, right? So
yes,
same. I would do the same stuff, you know, and probably more is better, you know. So there's supplements like vinpocetine and huperzine A that actually help dilate your blood vessels. More blood flow to your brain, less problems. And so there's a lot of that, and working on inflammation.
Okay.
Definitely.
Thank you.
And the fish oil, all that stuff.
Jonah wanted to say hi.
Oh, my great nephew. What a doll. What a cutie.
Can you take melatonin in the middle of the night?
You can. Most melatonin is immediate release, and it's probably not going to make you feel hungover. I mean, again, if you have to wake up at 7, and it might not be the smart, you know, if you 1 milligram, you'd probably be fine. You probably wouldn't want to take 10 in the middle of the night. And I actually take one that's a prolonged release one, so I also probably wouldn't use it in the middle of the night. But again, if you have an immediate release one, probably 1 to 3 milligrams, you're not going to have a problem. And again, if you can sleep into when you sleep in, then who cares? You know, take it when you need it. So.
Okay. Are there any other questions, please?
Yes, Ellen, I have a question.
Sure.
Hi, Cheryl. I don't know if you addressed this already, because unfortunately I had this in my calendar as 11 o'clock, so I came in late. I really apologize. But what do you think about some of that research on the ability to chew as being dementia protective?
The ability to chew?
Yes. What happens, and my interest in this is that I was a chaplain in long-term care for 15 years. And people will say, oh, the minute they went in a nursing home, they started going downhill. But a lot of times the reason people are in a nursing home is because they need pureed food and they're not chewing. And there is now some research, and I'm just wondering, as a doctor, what your take is on the ability to chew as improving blood flow to the brain and being somewhat dementia protective.
So honestly, haven't read the study, but it does make
sense. Well, there's more than one study.
Yeah. I mean, if you think about it, when you chew, you're exercising your jaw, which is going to help dilate blood vessels and help get more blood up into that area. It's also very important for, again, your digestive capacity, right? The first part of digesting your food is you have to chew it well to break it into smaller pieces, you know, so that the acid can then break it down further and you can break it down to the nutrients that your body can absorb. So I could see it sort of as both ways, right? You know, you get demented, you forget to, chew, you get worse, or again, just that I believe it, and I haven't really read about it, but it does make sense to me. Exercise is good for every part of your body, and that's right, that's your facial exercise.
Can you hear me?
Yep.
Yeah.
Oh, good. Hi, I'm Dee. Hi, Ellen. I don't think I'm on video, but that's okay. We work with a chiropractor here who works with a supplement called Standard Process. And
Very good.
By the way, I have enjoyed your talk tremendously. Thank you.
Oh, you're welcome. Thank you.
So I'm just curious, and he, tells us, recommends how much to take and et cetera. And what you had said about being careful about the supplements that you get. Are you familiar with Standard Process?
I am actually. Standard Process is an excellent company. It's actually from Wisconsin. I don't actually use it a lot because early in my training, I got involved with several other companies that are also really great pharmaceutical grade companies, Orthomolecular and Clear Labs and Douglas. And so I don't actually use them much in my practice, but I have lots of patients that use Standard Process. They all love them. They're fabulous products. Got no problem with them at all. And what you're saying is actually true. In functional medicine, there are a lot of chiropractors that go there. In fact, I went to a conference on brain chemistry where I learned so much about how the brain works. It just blew my mind. And I would say that 90% of the audience were chiropractors, or 80, I don't know exactly what, but it was a lot of chiropractors and, and then some PAs and very few doctors. And I was actually pretty distressed because it was incredible information. So actually a lot of chiropractors do this kind of nutritional supplementation, and many of them do have background in learning about it and functional medicine, and they do use these kind of good supplements. So I think you're probably getting good stuff.
Thank you so much.
You're welcome.
I got an email asking for references and scientific papers to support your recommendations. And I was just wondering if you've written anything scholarly on the topics, gotten published anywhere, and if you have articles that you would consider sharing with the Healthy Living group that they could read.
So one of my personal issues is not getting articles written in time. It's something I've been supposed to do for many years. So it's not my best skill set. That being said, I would say if you go to the Institute of Functional Medicine website, you're going to see all kinds of great, really smart information there with references to articles. I might be able to find some, but honestly, it's going to take me a while. So I'm not the best person to rely on for that. Just because my organizational structure is not very good for that. I'm usually too busy doing other things. But I'll get better with that as time goes on, but hasn't, this is early in my speaking career of trying to educate other people, the third talk, 2 of which were for Hadassah.
Good.
But sorry about that. But again,
But
go to the functional medicine website.
yeah, I can just say that I really appreciated your talk. There was a lot of stuff in your personal history that I knew and some stuff I didn't know. And also so much to think about and process in terms of a holistic approach to well-being, and just never really thought about inflammation in this kind of way. And I do think that what you're teaching, what you're sharing, and the background that you bring to it would be, I think, well received by other groups. And if you're going to consider doing this more, to have a pre-prepared set of articles that support some of it, like just, I mean, I don't know, just to think about how you can make your points more
give you the evidence.
Effective. Yeah.
Absolutely. Get around to it sometime.
Eleanor?
Yeah, I would like to add one personal comment. When I turned 60, I was still working full time, but I realized I was probably losing muscular strength. And so I bought weights. I bought 3 and 5 pound weights, and I started a weight routine at home. And then I realized I could use heavier weights. And that is something that I do 3 times a week. And I now have 8 and 10 pound weights. And I hold the 2 10-pound weights, and I sit and stand with no help from my arms, because years ago, I noticed that older people lost the ability to get up out of chairs. And that really is a devastating function to lose, to need help getting out of a chair. And I think that when we can once again come together, the Niskayuna Senior Center has a senior exercise class, which incorporates weight training and functional skills. And it was very, very good. So for those of you who are inclined to maybe work on physical strength training, work on muscle strength for legs and arms is really important for older people. I'm going to be 83, and my goal is to be able to get in and out of my kayak.
I was gonna say, you're a young-looking 83, so I think you're doing something right, obviously. And again, that is great.
I have to share with you, we've gotten wonderful positive comments about your talk from the chat room. I want everybody to go look in the chat room. People have found this presentation so very helpful, as have I. This has really been wonderful. Do we have any other questions from the participants?
Well, somebody asked or wished that you lived closer to us.
Yeah.
Given modern technology, seems like it wouldn't be so hard to continue having a relationship.
So this is
yeah.
good.
No, I know from our personal conversations at our on our family chat that you got that also request when you did the Hadassah presentations. So I just, if you wanted to share.
Yeah, and really, Zoom has made it so that really I could see people all over the place. Main issue being that my malpractice insurance doesn't cover me if I'm treating somebody in another state. Now the fact is, I sort of do anyway. They're usually people who are my friends. And again, I don't really expect to have a malpractice problem, but I haven't I don't advertise to do long distance stuff, but on an individual level, the fact is, right, this is right. I do Zoom consults now. I'm seeing 2 to 4 new patients a week, and I'm doing it from here, so So I've thought about and looked into what would it take to be licensed in other states, just in terms of being safer in the malpractice world. Again, one of those things that hasn't come to the top of my list of things to do yet. So, but look locally. But if you can't find somebody, talk to Rafi and we can talk about what's possible.
Okay.
And I do have a business. I have a website called A New Way Forward. That's my current practice. Again, you can, not that my website has the most information, but again, you can learn some more about things there.
Jan, you have a question?
Yeah, I've always been interested in practice natural living for decades and decades. One of my kids' first words was, like, I can't even think of it now because I'm getting old, but it's something I'm used to. Very hard to find a physician that will take my insurance.
Oh, you mean
so as Medicare is my primary, but are there functional medicine practitioners who do that?
Absolutely. And again, while many of them might not be, like, for instance, I no longer take insurance because it was part of me trying to figure out how not to keep answering to insurance companies and wasting my time arguing with them when I was smarter than them. And I had to figure out how not to get angry at them. So I no longer take insurance. But when I have a Medicare patient, a lot of the functional medicine lab testing that's very expensive, but very deep testing. Like, for instance, I use a lab called Genova Labs.
Yes.
They do the microbiome testing I do, and food allergy testing, and incredible organic acid testing and all that stuff. Well, they have a contract with Medicare. So when I have a patient, I can give them these like a microbiome test, they would bill out to insurance for $2,200. Nobody pays that. But, in my office, I can buy those kits and give them to people for $500. But if you have Medicare, I can actually say bill Medicare, and you can actually get a lot of those great functional medicine tests for free, covered by Medicare, but you're just going to have to pay the provider for their time.
Yeah. The word that slipped my mind, when my daughter was in kindergarten, she turned down the peanut butter offered because she asked if it had hydrogenated fat.
Oh my God.
That was 40 years ago.
That's pretty impressive. Young people are way smarter than we were. Again, we weren't trained to even understand that. I mean, if any of you are, closer in my age range, right? I mean, when I grew up, like, it was more is better. It wasn't like look for better food. Like, it wasn't like better food is better. It was like more is better, right? You go to these big fried chicken buffets and eat everything you could, so it was a whole different world of what we understood, so very impressive. It's very impressive, that's sweet. So, yeah, I like to tell people I knew that American cheese was bad when I was a kid. I wouldn't eat it,
What about Velveeta?
That was bad too, though I will admit that I think my mom used it in when she made poached eggs and cheese, and I kind of still like that. But no, we never ate it plain, and I've never bought it as an adult. Kind of like cheese curds. People in Wisconsin like cheese curds, but really I look at that as that's the part of the cheese that you're supposed to throw away. That isn't really the good part of the cheese. So I don't understand it, but anyway, some people like that fresh squeaky stuff, I guess.
Okay, well, we have definitely gone over our hour, and I deeply appreciate the time you've given us. This has been a very wonderful, informative talk. I think we've all learned a lot from it. If you can hear us.
Thank you.
Clapping, we
I
thank
can hear you and see you. Thank you very much.
sharing all this information with us, and for your nephew to bring you to our attention. And it's a wonderful way to kick off Hadassah Shabbat, but it's also wonderful for the Healthy Living Group. We have been dealing with some of these issues for many years. I mean, we talked earlier about the side effects of statins and other drugs. So this has really exemplified and clarified a lot of the things we discuss, and has been most helpful. So I greatly appreciate your time. Thank you very much. And thank you all for attending. I appreciate your giving of your time. I think we all learned a lot. Everybody.
Bye.
In our area, we have sunshine today, so we should all go out and not use sunscreen and absorb 20 minutes of sun rays.
Absolutely.
But watch out for the slippery spots.
Yeah.
Oh, I think the sun is melting it. Let's hope so. But do be careful and take a walking stick with us.
Yeah, I always walk with walking sticks. And if you don't know about yak tracks, You know, there's like these
Oh,
like
yeah.
metal things you can clamp on the bottom of your feet that make a huge difference and decrease risk of falling like 80%. So again, another tool if it's icy.
Yes.
So,
Or crampons. Are you talking about crampons too? Are those?
Yeah.
the same
yeah,
thing?
like they're like a one
Yeah,
brand
they're
is called
really
Spitzer.
wonderful
They're
and
like
very
clamp on things with either wire, like screen, you know, like a loopy thing on the bottom that just kind of cuts into the snow or ice better, and it just gives you a really different layer of traction. So, yeah. Good.
Okay, well, we thank everybody.
Thank you so much. I'm going to close down the room.
Okay.
Okay, thank you.
Okay,
Thank
everyone.
you.
And Cheryl, we're going to give you a call.
Okay.
We'll see Healthy Living
Alrighty.
people. Anybody is welcome to join Healthy Living. We meet every Wednesday at 10 o'clock in the morning.